Okay.
Well, good morning, everyone. I'm delighted to be with you this morning to talk a little more about implementation science, theories, frameworks, and models. Let me see if I can get my slides up. This will probably be the biggest test of the day. All right. I think I need to switch this over here. Everyone see the slides all right? Not in presenter view?
You had it
No,
the opposite.
Oh, see,
I mean, but if you want, I made a little introduction for you so everyone from around can know who you are, if you'd like.
can everyone see the slides now
yes,
and not in presenter view?
no.
All right, good. So again, thank you for joining this morning. As mentioned, my name is Larry Hearld. I am one of the consultants with the UAB Center for AIDS Research Implementation Science Hubs. And one of the things we want to talk about here today is implementation science theories, frameworks, and models. And what we're really trying to do is just kind of give you a brief introduction to these theories and frameworks that you hear a lot about. One of the hallmarks, good and bad, of kind of this emerging implementation science field is this proliferation of frameworks and theories and models, and it can be a bit daunting at times trying to sort through them and understand how to use them, when to use them, and so forth. So based on some feedback we heard from the projects last year, we decided we would kind of move this up a little earlier in the year to hopefully kind of demystify some of this, some of the language and things around these theories, frameworks, and models. So you know, my objectives today are, I think, pretty modest. First, I'm going to define and try and distinguish between different implementation science theories, frameworks, and models. And you know, these terms are sometimes used interchangeably, but in fact, they are different. So first, I would like to establish some conceptual and definitional clarity around these terms. Second, I'd like to provide kind of a high-level overview of commonly used implementation science frameworks and their purpose in implementation science studies. Third, I'd like to make the overview a little more tangible and relevant to you all, and I'd like to do so by providing some examples or illustrations of how these frameworks can be used in different types of implementation science studies. And I'll conclude by offering some resources for all of you who may be interested in applying some of these approaches to your own research. So let's start by distinguishing between theories, frameworks, and models. A theory can be formally defined as a set of principles or statements that describe a relationship between two or more variables. And the key thing to keep in mind with a theory is that it is useful for its ability to provide a potential explanation for how and why relationships exist between two or more variables. As a result, theories are often used to help elucidate the causal mechanisms and enable us to predict what will happen when we do something. A model, on the other hand, is really just a simplified version of some oftentimes more complex phenomenon. So unlike a theory, a model is descriptive. It's not explanatory. But in the case of a model, it still oftentimes relates things like two or more variables that we're often interested in. And finally, a framework can be thought of as a structure or a system of descriptive categories. And the key word here is being descriptive. So frameworks do not provide explanations, just like models. They simply organize things. They kind of categorize things into convenient buckets or heuristics that we can use for our research. So let's work through an illustration here to see if it can make some of these ideas a little more concrete. I'll start with a well-known framework that some of you may be familiar with, and that is the Consolidated Framework for Implementation Research, also known as Cifer. And most of you who may be familiar with this know that it consists of 5 major domains: outer settings, inner setting, process, characteristics of individuals, and characteristics of the intervention or innovation. And I know we heard at the kickoff meeting, many of you are actually using this framework, and I think what the plan is to offer a more in-depth exploration of how you can use Cifer in your own research. But today I'm just going to kind of use it as an illustration and won't go into great depth. So for this illustration, let's focus on 2 of these domains, the outer setting and inner setting. As you know, with the Cifer, each of the 5 macro domains contains a number of micro domains. So for example, the outer setting includes things like patient needs, peer pressure, and external policies and incentives. Likewise, the inner setting consists of things like the implementation climate, the overall organizational culture, or perhaps the structure of the organization. For example, is it hierarchically organized, or is it a more flat and decentralized organization? And as this figure intends to illustrate, the Cifer really just organizes these different features or microdomains into groups of things. And in this case, the 5 macro domains of the outer setting, inner setting, process, and so forth. And as a framework, the Cifer doesn't really try to make any suggestions or inferences about how or why these different domains might be related to each other, or even the intervention's effectiveness, right? So if you're thinking about going out and doing interviews or collecting data using surveys, you could organize some of those responses into these buckets, into these things, but it doesn't necessarily tell you, based on the framework alone, whether these things would be positively or negatively associated with implementation. If one were so inclined, however, you could try and relate these different domains, right? So for example, we might believe that the outer setting doesn't directly affect implementation outcomes, but rather it works through or is mediated by the inner setting. Now, this is a fairly common thing in organizational studies. We know that these external influences work through organizational structures. So for example, external incentives or changes in reimbursement may not directly affect an intervention's effectiveness. Rather, they may alter the implementation climate in ways that result in better adherence to the intervention and subsequently better outcomes. Thing to note here is that as a model, it suggests a relationship between these things, but the reason why these things are related is still not made clear. And for that, we really need a theory. So building on the same figure from the last slide, a theory, or maybe many theories or several theories, can help us understand why these things like the outer setting and inner setting and implementation outcomes are related. So for example, we know from a lot of organizational research that organizations are dependent on and responsive to their resource environments. We know that organizations sometimes make decisions in somewhat predictable ways about what things to change internally and how to change them based on the resources in their external environment. So things like reimbursement, regulations, competition, these are all things that would influence organizational decision-making. In this case, these ideas are summarized in something called resource dependence theory. This is kind of a classic organizational theory used in to understand organizational behavior. Likewise, let's say we want to know how the inner setting here may affect implementation outcomes. That is fundamentally a question of how and why, right? How is it that the inner setting would affect these implementation outcomes? Well, one theory that can help us understand why the inner setting may affect implementation outcomes is the theory of organizational readiness for change. And according to this theory, readiness consists of two dimensions, capacity and motivation. Based on these two dimensions, we might argue that certain aspects of the inner setting, like organizational culture, improves implementation outcomes because it increases employee motivations to implement the intervention with fidelity. Right? So this is sort of the underlying causal mechanisms by which the inner setting is expected to affect the implementation outcomes. So as you can hopefully see here, theories help us understand the causal mechanism between different concepts that are typically delineated in a model. So in essence, theories fill in the gaps or the arrows that you often see in these models, right? So this is where these theories kind of are so valuable. So now that you hopefully have a little better understanding of what theories, models, and frameworks are and how they differ, I want to talk a little bit about the role they often play in implementation science studies. So the figure here was adapted from a book chapter by Per Nilsson. And this is based even on an earlier article he wrote in 2015. As you can see in this figure, he has distinguished between 5 different categories of theories, models, and frameworks that are used for 3 general purposes in most implementation science studies. And don't worry if you don't know these different categories of theories, models, and frameworks, because I'm going to explain them in a little more detail in the slides ahead. So first, here on the left-hand side, you have process metals, which are generally used to describe or guide the process of translating research into practice. In the middle, you have determinant frameworks, classic theories, and implementation theories. And these are typically used to understand or explain what influences implementation outcomes. And finally, over here on the right-hand side, you have evaluation frameworks, which, as the name suggests, are typically used to evaluate implementation. Is the implementation having its intended effect? Is the intervention having its intended effect? So as noted before, process models are typically used to describe or guide the process of translating research into practice. Some of the more commonly used process models in the implementation science literature include the knowledge to action model and quality improvement frameworks like PDSA cycles that some of you may be familiar with. These also include stage-based models or frameworks like the exploration, preparation, implementation, and sustainment framework, also known as EPIS, and the stages of implementation completion that you all will become familiar with based on your work on the outcomes crosswalk that you will be working on. And the idea behind these models is that you can link certain steps together over time to illustrate how things progress. So I've listed here a sample aim that you might think of when using a process model. So for example, you might have an aim that says something along the lines of to assess whether stakeholder perceptions of acceptability and feasibility of fill in your intervention or implementation strategy differ by stage of implementation. So the question is, do these perceptions of feasibility and acceptability depend somewhat on where an organization or a group is with respect to implementing this intervention? As I mentioned before, determinant frameworks describe. They identify factors, both facilitators and barriers, that influence implementation outcomes. Some common determinant frameworks in the implementation science literature are the Cifer, the Promoting Action on Research Implementation in Health Services, also known as PARIS, and even the ecological framework that many of you are likely familiar with. And I've denoted here with asterisks ones that have established and a growing list of validated measurement instruments, which in part accounts for their popularity. When we talk about the Cifer later on in the year, I'll talk about the fact that one of the reasons why I think Cifer is so popular and so commonly used is that there are a lot of good tools and resources out there to apply Cifer. And as a result, I think more and more people tend to gravitate towards Cifer for those reasons. And once again, I've listed here some sample aims you might think of when using a determinant framework. For example, you might have an aim that says something like to determine the barriers and facilitators of using, again, fill in your intervention or implementation strategy from the perspective of diverse stakeholders. Or more generically, you might have an aim that says to assess the contextual factors of the intervention settings that influence utilization and dissemination of the intervention. Regardless of the specific language you use, I think as you can see here, determinant frameworks and the corresponding aims typically seek to identify and organize things. They're not necessarily intended to explain things in the way that theories do. Classic theories are those theories that originate from fields outside of implementation science. So some of the classic theories you may see used include Rogers' theory of innovation diffusion or social cognitive theory. There are also a wide range of organizational theories and social network theories that are applicable in a lot of implementation science studies. So again, some illustrative aims that might be based on classic theories include to evaluate how local communication networks influence the diffusion of some intervention, or to assess how network centrality and density affects the spread of some intervention. So these are aims that would sort of directly build on these classic theories of related to implementation. Implementation theories are a lot like classic theories, except that they have originated within the implementation science field and are typically developed or modified by implementation researchers. Some commonly used implementation theories that you may have encountered or likely will encounter include the organizational readiness to change theory I mentioned earlier, and normalization process theory. Some illustrative aims that might include implementation theories include something like to examine how organizational readiness to implement change influences fidelity to some intervention or even implementation strategy. Finally, we have evaluation frameworks, which are used to specify aspects of implementation to be evaluated to determine whether the implementation was successful, right? This is ultimately what we're interested is to know whether this intervention or again, maybe an implementation strategy had its intended effect. That it typically entails some kind of evaluation, and that's where we would typically invoke some kind of evaluation framework. Some commonly used evaluation frameworks in the implementation science literature include the REAIM framework, which I suspect many, if not all of you are familiar with. The precede proceed model or framework is another evaluation framework. And the Proctor outcomes framework is yet another kind of evaluation framework you could consider using. Some illustrative aims that might utilize these frameworks include to compare the clinical effectiveness and maintenance of video-based visits versus site visits for the delivery of care to cardiometabolic patients. Or you might have an aim that says to estimate the reach of video-based visits to adults 19 and older with cardiometabolic conditions and identify patient-level predictors of immediate and sustained reach, right? So these ideas of effectiveness, maintenance, or reach are all drawn from the REAIM framework. And you'll learn a lot more about those, especially as you work through your outcomes crosswalk. So it's worth noting that these theories, models, and frameworks can be mapped onto logic models that are often expected in grant proposals. As you know, a logic model is simply a description, often graphical, of the hypothesized chain of events leading to an outcome of interest. So in essence, Logic models help unpack kind of the if-then relationships between various elements leading to an outcome. So here I illustrate one way you could think how and where frameworks, theories, and models might be used in conjunction with your logic model. Or at the very least, this is how I think of it. So for me, process models down here, in many ways provide a good overarching roadmap that links the study aims together. And I think this is especially true for large, complex studies that may have aims that span kind of the implementation spectrum, from these kind of contextual determinants way over here, all the way down to the outcomes over here that we're often interested in. So these process models, again, kind of help us think through and link together these different parts of the logic model. Determinant frameworks, on the other hand, I think are particularly helpful in organizing the context in which interventions and implementation strategies are applied. Consequently, determinant frameworks are frequently used in the early stages of the logic model. Or if you're thinking about this in the context of a grant proposal, you often see people using things like Cifer to understand what community or organizational factors are believed to support or hinder the use of an evidence-based intervention. This is a fairly common approach in a lot of implementation science studies, to have that kind of as your first aim, right? We want to understand the context in which this is happening so we can understand whether we need to, what kinds of strategies we might need to consider, for example. And then again, this understanding can be then used to identify or develop implementation strategies to overcome barriers to implementation. Evaluation frameworks over here, as I mentioned earlier, are especially helpful in systematically thinking through the outcomes you may want to include in your study. And this is true for both the intervention and the implementation strategies that you may be examining. And as I've been mentioning, you're going to get a crash course in applying the re-evaluation framework and working through your outcomes crosswalk in the upcoming year. So you'll learn a lot more about the use of evaluation frameworks in the months ahead. And then finally, classic theories or implementation theories down here are especially useful for filling in the gaps and linking the different parts of the logic model. So for example, some logic models will specify the causal mechanisms between implementation strategies, interventions, and the outcomes. And these classic theories and implementation theories, because they help us understand how and why things are related, are ideally suited to unpack these underlying causal mechanisms. So this is just one illustration, I think, of how these frameworks, theories, and models might fit with your own logic models. It's by no means the only way. So for example, you could use process models in a more focused way within one of these steps in the logic model. But at least big picture, hopefully this helps you organize and connect kind of frameworks, theories, models, and logic models together as you think about your own work. So I want to conclude this part anyways with a few considerations and takeaways, and then I'm going to kind of go through an example, a couple examples. First, I think it's important to try to think of frameworks, models, and theories as a guide for your research and not as a straitjacket. One of the primary value adds of frameworks and models is to help you think systematically about the things you need to consider in your research, whether it is determinants as inputs or factors bearing on your intervention or outcomes to be evaluated. You sometimes see people kind of twisting themselves in knots, trying to either fit a framework or a model to their topic or vice versa. And keep in mind, you don't have to adhere this kind of dogmatically to a particular framework or theory. It may be that certain aspects of a framework or model are not pertinent to your study. And if that's the case, you shouldn't force fit it. You should think of this as a tool, just like any other tool, just like a a method, a statistical analysis. And that's really the value of frameworks and theories. So by the same token, you don't necessarily need to adopt these frameworks wholesale. In other words, you don't have to use every element. And I'll go through an example in a minute where I show you where we use certain parts of the REAIM framework, but not all of them. And I think you'll find that in your own work as well, and when you're working through the crosswalk. So, again, use the framework to think through what is pertinent, but don't force it, I think is the bottom line here. Second, know that no single theory, framework, or model is necessarily the best one. I think many of us have our own preferred or kind of pet frameworks, but all of them have strengths and weaknesses. And your choice of framework or theory should ultimately be driven first and foremost by your aims. And if you're doing some open-ended exploration, then a determinant framework may be especially appropriate. As I mentioned before, I like to use process models to help provide kind of this overarching design, either of that specific study, or even more generally, how you might think about studies being linked. For example, you might be doing kind of exploratory work now that's trying to understand contextual determinants or contextual factors that lead to a particular strategy, and subsequent work will build on that, or the reverse could be true. So a process model can help you think about a sort of line of research, the whole research agenda, if you will. Another consideration when thinking about which framework works best for you is to consider what measurement instruments exist. As I said before about Cifer, there's a lot of instruments, a lot of work that's been done to kind of support Cifer. I personally tend to prefer frameworks where pre-existing and preferably validated instruments exist. I think there's many advantages to this, including just being able to kind of point to those kind of instruments when developing your own proposals, but even downstream, if funded, thinking about how to actually implement a study and get it up and running quickly. Having these existing validated instruments can help you move from that sort of pre-award to post-award stage much more quickly. The last thing to take away from these remarks, I think, is that you have a lot of frameworks, theories, models at your disposal, and you may need more than one, especially if the scope of the project is large. So let me provide one or two last examples to kind of help illustrate these ideas. So one study that I'm currently involved in is a PCORI-funded implementation study that is examining whether a set of standardized and customized implementation strategies can facilitate the implementation of a shared decision-making aid, and excuse me, how the contextual circumstances of the 15 participating clinics may influence the use of these implementation strategies, right? So basically, there was an initial study that established the effectiveness of this decision aid, and the follow-up study that we're working on now is trying to understand the best way to get clinicians to use this decision aid routinely. And this is basically originally a tablet-based decision aid that patients would view while in the waiting room, that would provide information about their medications that they can use to treat their lupus, and the idea that they would then use that information to engage in a more meaningful conversation with their physician about what's most appropriate for them. So that's kind of the background, the premise here. In this case, we are using a mixed methods observational case study design, due in part to the recognition that these contextual circumstances of each clinic will likely have important implications for the strategies that the clinics ultimately decide to use and their ability to deploy these strategies. In this case, we are using 3 different frameworks across the different aims of the study. And that's kind of what I'm trying to illustrate here. The first aim is a formative assessment of stakeholder needs and the contextual circumstances of the 15 clinics that are participating in the study. And this aim is using the Cifer framework I mentioned and the theory of organizational readiness to implement change, as well as a couple of kind of classic theories around organizational learning. The second aim, which is kind of the heart of the study, where the implementation strategies are put into action. Here we are using Powell's typology of implementation strategies, which in many ways I think you can think of as a determinant framework. And we're also using Proctor's outcome framework to define our outcomes. And then the third aim focuses on sustainability. And in this case, doesn't really use any framework, although it is in many ways kind of encompassed by Proctor's outcome framework. So again, going back to this idea with large studies that may have a number of aims and may span a large part of that implementation continuum, you may need to draw on multiple theories. In this case, we have at least 4 theories or frameworks that we're using in this study. And this figure just kind of illustrates what I noted on the previous slide. We're using these different frameworks. So as I mentioned before, we have this initial aim where we're doing this, in a sense, sort of a needs assessment, a formative evaluation. We're trying to identify areas or barriers to change. And we're using that information to select activities for implementation. And that formative assessment is guided by the Cifer, theory of organizational readiness to implement change, which is an implementation theory, organizational learning, which is a classic theory, and also some of the literature on psychological safety, which is also kind of from a classic theory. The second aim, where we're actually deploying these strategies in each of these clinics, this is again in some ways guided by Cifer, but also most importantly guided by Powell's typology. So basically the idea is that clinics are offered a menu of implementation strategies that they can use, that they think is most appropriate given the barriers identified in this formative assessment. And they would choose those strategies that are most relevant or they think are most feasible in their setting. And that's what's going on in aim 2. And then of course, we're looking at some effectiveness outcomes and downstream the sustainability of the decision aid. And for that, we're using, this should say Proctor's outcome framework, sorry, not Powell's. Like I said before, one of the things to note, we didn't necessarily adopt and use every aspect of each of these frameworks. So for example, with the REAIM framework, we didn't necessarily include measures of adoption, in part because of the way that the sites were recruited. In other words, by virtue of recruitment, there was no way to say who did or who did not adopt. Basically, everybody we reached out to, I guess we kind of strong-armed them into participating because all of them agreed to participate. And as a result, there really isn't any variability in adoption. So this is not really a meaningful outcome in the context of this study. So this is not one of the elements of REAIM that we're including in our evaluation here. The last one I'll mention, just part because it's, I think, maybe a little more relevant to all of you who are working in sort of the HIV/AIDS space. This is from a proposal that we recently developed that was really trying to look at kind of this bundle of interventions, right? Where we're trying to get organizations to do community-based testing. This is public health agencies to make appropriate referrals to practitioners and to get people who are diagnosed with HIV to get started antiretroviral therapy medications, right? So we have this bundle of interventions that we're trying to get implemented in these agencies. The first thing we're looking at, however, is kind of the contextual circumstances that may influence the ability to implement this intervention, this bundle of interventions, right? And so again, we're using Cifer here to kind of help guide our understanding of whether things like there are community resources or social support or stigma around HIV that might affect their ability to use these interventions. Also using Cifer to understand things like the implementation climate and how much support there is from leadership to do these things. This is all part of our proposed AIM 1. Second part of the study, AIM 2, is really trying to then understand to what extent is this bundle of this intervention bundle affecting these different clinical and implementation outcomes. So you can see here, this is again drawing upon re-AIM. So we have a set of implementation outcomes that address things like reach. What proportion of patients were linked within 30 days? And looking at things like fidelity and adoption and acceptability, which are both adoption and implementation outcomes within the re-AIM framework. And then we also have clinical effectiveness outcomes. So again, we have Cifer, we have re-AIM here with the outcomes. And then one of the last things that we're trying to do with this proposal is to understand which strategies might be most effective if we were to sort of try to disseminate this intervention bundle to other settings, to other public health agencies. How would we do that? What would be the most effective strategies to help other agencies implement this bundle? And to do that, we're proposing using an implementation mapping process, right? How do we, basically this is in a sense sort of a kind of a process framework. How do you go through these steps to say, what is the most appropriate strategies that would work to help implement, again, this bundle of interventions? And this would sort of lead to some future research down the road. So point here again is that you may end up using multiple frameworks to for different parts of your study. The more aims you have, I think the more likely it is you'd need to draw on different frameworks and different theories to help motivate in what you're trying to do in the study. So the last thing I want to conclude with before opening up to any questions are a few resources for those of you who are interested in learning more about implementation science models and frameworks. So first, I provided a couple of references for articles that I think provide good overviews of the different types of models and frameworks and how they can be applied. The article by Nilsson, this is the one I mentioned earlier, and I think is particularly helpful in differentiating the different types of theories, models, and frameworks. So I think that's a very good entry point. Likewise, this other model sort of talks about, I think, some really effective tips for how you would actually use these frameworks. So one kind of tells you what the frameworks are. The other one, I think, helps you explain a little better about how you would use them. At the bottom here, I've highlighted a couple of web-based resources that I think could be helpful for you in selecting a particular theory, model, or framework for your own research. In particular, I'll highlight this first one. This is a website that has a lot of different sort of options. It's a pretty extensive list of different theories, but the nice thing about it is it allows you to use different filters to focus on a theory or narrow the list of theories that or frameworks that might be most appropriate for you. So for example, it asks, at what level is your intervention focused on? Is it at the community level? Is it at an organizational level? Is it at a clinician level? Is it at a patient level? And based on what you decide, and it can be multiple levels, it will narrow that list of theories and frameworks that might be relevant for you. And likewise, I think it has options for what stage of the implementation process are you at? Are you in sort of the preparation stage, or are you in the actually stage of scaling up your intervention to other settings? So it's I think, while a little daunting at first, trying to familiarize yourself, once you get the hang of it, I think it does provide a really useful tool to help narrow the list, because by last count I've seen there are well over 100 different frameworks, theories, and models. So it can, again, be kind of daunting trying to figure out which one makes the most sense for your own work. Of course, as I mentioned, this is not an exhaustive list of resources. There are certainly others out there, but hopefully these provide a good entry point for those of you who may be interested in learning more about these. So with that, I'm gonna shut up for a minute and ask if there are any questions, any comments that I can address for folks who joined.
I have a question.
Mhm.
Hi, Larry.
Yeah,
Thank you. Wonderful presentation. Thank you. You've helped to simplify things or organize things in my brain. So I've also been on a project I'm not the head of, but we're using quality improvement ideas. How does that relate to all this?
When you say quality improvement ideas, you mean like using quality improvement framework or some type
Yeah.
of framework?
I guess it's a framework. Yeah.
Yeah, I mean, I think most times people would think of those as sort of probably more of either a process or determinant framework. I mean, it's a pretty broad set of frameworks, but most times they would, I think, probably typically, depending on which framework you're talking about, would be more of a process kind of model that you would think of. For example, the PDSA, right? That's an example of kind of a process framework. So that's where I'd categorize it, but I don't know if that quite answers your question.
I'm not exactly sure what my question is. I'm just aware that, we're doing this, but we're using quality QI stuff, and I just didn't know how it related to all this stuff.
Yeah, again, I think if you're trying to categorize it, which, I think for people new to the field, it's helpful to be able to categorize things and put them in these different buckets and put a label on it to kind of sort out the different frameworks and theories and kind of get a lay of the land and think about which one might make the most sense in a given project and where it fits. But ultimately, I think the more important part is, how do you actually use that framework, or how do you use that theory? And I don't see a lot of people coming out and saying, well, in a proposal saying, well, we're using a determinant framework, we're using a process model, we're using, those kinds of labels. I don't think that's important. I think that's important for all of you and us to sort of say, okay, these are these different types of theories, and this is how we might deploy them in the context of a large study. But really, when you're talking about like a quality improvement framework or something like the PDSA, the more important part is, how do you use it? Is it a right fit for the aim or what you're trying to accomplish with that aim? So I think that's a way of, despite giving you this long drawn out presentation about different types of theories and frameworks, don't get so hung up on the labels and such that you think, well, I have to sort of incorporate this terminology in my own proposals. The more important part is that you're actually using a theory, I think, or a framework, and you're using it in a way that's consistent with what you're trying to accomplish with the aim.
Mm-hmm. I mean, I'm thinking that the quality improvement helps you to, using that terminology helps you to think about how organizations move forward in increments.
Uh-huh.
And I'm wondering if that kind of thing is, there's so much to cover in here, but that really helps to think out how you're going to move organizations, because you have them do these sort of micro steps along the way. Yeah.
And for those of you who may have seen the chat, Mike Muggs, you mentioned that there's been discussions around things like CQI and some of these quality improvement activities as being implementation strategies that are used to implement interventions, right? And I think that's true. And I think it also highlights the fact that there are kind of shades of gray here, or it's not always clear cut. What's the distinction between a strategy and an intervention? And an intervention in one setting could actually be an implementation strategy in another. I mean, it makes things confusing, no doubt. I don't know that we want to get into that conversation right here today, because it does get again rather confusing. But I think you're right, Muggs, in that this you could also think about those kinds of CQI or QI activities as being strategies, as well as an intervention itself, and that may change how you would think about using one of these frameworks as well.
Thank you.
So for a number of other hands up or questions, I'll just kind of go left to right on my Hollywood squares here. Greg.
Thanks, Larry. That was a great presentation. I think I'd seen another version of it, so it helps to hear more than once to get it all to sink into my
Hopefully I
brain.
was somewhat consistent.
Yeah, no, it was excellent. I did have a question on your study flow chart that I thought was awesome. I really liked how you synthesized this giant study and comprehensive study into one slide. But I'm particularly interested in that bottom square that I think you called implementation process. And I guess, is that where the stages of implementation complete? Like, I guess I'm wondering if you could say a little bit more about how you're operationalizing that and what models, I guess, or you're using to actually to meet that, to describe that process.
So is this the very last slide when I was talking about the
yeah, your aims, and then so the bottom, and I think it had, you called it implementation process.
Implementation mapping process?
Mapping, yeah. And can you, like, are you using the SIC, or what are you using?
Not using the stages of implementation. This is all, the intervention mapping process is something that sort of builds on, if you're familiar with the intervention mapping process, it's the same idea. There's these sort of defined steps that you would go through to identify or develop an intervention, in this case applied to implementation strategy. So there are sort of steps, defined steps that you go through, right? You initially do some kind of needs assessment amongst your stakeholders. So sit down, you could do focus groups, you could do interviews, you could do a number of different data collection approaches, but the idea is to understand, well, what are your needs? What are some of the things that you struggle with in your particular organization, for example? And then based on that, you sort of take those needs, you take those kinds of gaps that the organization has, and you basically try to map those onto what the organization is trying to accomplish. What are your goals? What are your objectives? What are what are the resources you have to achieve those goals? And from there, you can move on to the next step, where you actually begin to identify, select, and prioritize implementation strategies. So you may initially come up with a long list of potential implementation strategies. In this case, we're talking about using different Delphi techniques to say, okay, based on this long laundry list of implementation strategies, which ones do we think make the most sense? And we would prioritize as strategies to use to implement this bundle of activities. And so that's kind of what it's, when I say it's an implementation mapping process, that I can give you some resources or references for it, but it's basically a process, a guided process for going from recognized needs of a particular community or organization to a defined set of, in this case, implementation strategies, but others originated when you're trying to develop a new intervention.
That's helpful. So you're not actually using it to quantify or describe the implementation process, but more to figure out which strategies you want to use. So it's more on the, it seems more front loaded.
That's exactly right. So in that case, this is, yeah, we're kind of moving back upstream, if you will, if you think about it in terms of a logic model. We know, we're trying to establish whether this intervention, this bundle of interventions is effective. And assuming it is, how do we get it into practice? But then in between there, how do we find out what is the most appropriate strategies we can use? And this implementation mapping process just provides a kind of structured approach to trying to identify those strategies.
Great, thanks.
Yep. Lauren.
Hi, thank you so much. I just want to start by saying that this was awesome. I just finished a whole fellowship on implementation science, and this is kind of the critical thing that was missing for me the whole time. I kept thinking, could someone just help me organize how all these awesome things fit together? And you did that. So
Good.
major kudos. That was awesome. I have way too many questions for the next 8 minutes, and there's 2 other people that have questions. And so I'm going to start with the most important ones, and then I might throw some things into the chat that I think are kind of just easier follow-up type things, not to gobble up your time too. But first thing is, you mentioned bundle of interventions, and I like the way you say that. You know, it makes sense in layman's terms, but as I'm actually preparing for the work via this supplement, but I'm also funneling it into a K I'm about to submit. And one of the issues that I'm coming up with is, as I think about what you just said, a bundle of interventions that I've already tested as a bundle, and now I'm wanting to adapt it using the Adapt It framework. How do I say that so that it doesn't sound like a bundle of interventions, right? Like, can I call it already an EBI, given that I have tested it previously? Or how would you reference whenever you're testing a bundle? Do you call it a protocol?
How would I describe the bundled intervention itself? I mean, I think what I see most frequently in the literature is either a bundled intervention or a multifaceted, multi-component intervention. You'll see those terms used. The idea is that there are multiple components, multiple dimensions or aspects of this intervention, but you are applying them collectively. You're not trying to, I believe anyways, based on what you're describing, you're not trying to isolate or assess whether one component is kind of a core component and is the most effective part of that bundled intervention. So again, I think going back to what you typically see in the literature is, I think calling it a bundled intervention, bundled evidence-based intervention, if you've already established the effectiveness of it.
Okay.
You'll also see, again, evidence-based, multifaceted. That's a little more clunky, more cumbersome, but I think you want to emphasize the fact that it's evidence-based if you've already established that it's, that it's effective. But whether I think there might be some preferences, but I think it's just that preferential, whether you call it bundled, which might imply that it's a package a little more clearly if you call it a bundled evidence-based intervention versus this multifaceted or multi-component intervention. So I'd probably lean a little more toward calling it a bundled intervention, but again, you will sometimes see the other term.
Okay. Yeah, I've been calling it multi-component, but I like bundled. So the next thing is just about process mapping. So you talk a lot about implementation mapping, and I'm part of this supplement. For me, my first aim is to conduct a process map, and the second is to conduct one-on-one interviews to identify determinants. And I'm struggling with really differentiating. Ultimately, I'd like to have 2 strongly differentiated manuscripts, and then eventually do internal dissemination together. But I'm applying the Cifer to both. And so it's confusing to me how far really to delve in with process maps versus when I'm getting into the territory of actual determinants. Does that make sense? Process versus determinant stages, because you differentiated them in your figure, right?
Yes.
Is there kind of a seminal process map explanation article that can really help me understand this?
Yes, on that I can get you some references to maybe help you sort that out. So
Okay.
why don't I do that while we can move on to others, and I can find you some resources to, I think, help sort that out.
That'd be great. Thank you.
Sure. David, I see, is next on my list.
Yes, thanks so much. So I also great talk. Kind of a quick question. One of the things I was thinking when I was looking, or when I was, kind of listening to your talk, and as you were trying to kind of really examine all the different aspects of implementation science, and generally, like when I've submitted grants, I've gotten feedback on how well it kind of fits with the particular, I guess, mechanism. In this case, would be implementation science. And I guess in this context, I got the the greatest feedback, which was, yeah, you're funded, but no one actually ever commented on the specific proposal itself, which sometimes can actually give some good critical feedback to improve it. And I guess I'm wondering, in this process, is there actually feedback out there about our proposals, how well they might fit with kind of implementation science, suggestions that may actually be very specific for us to improve what we have on paper so far? And if there isn't, is that possible in some other is there some other way of obtaining that?
I'm gonna open this up to some of the other folks, particularly Robin and Muggs, who are on the line. I don't know that we actually have talked about this having it built in right now, but it seems like this is something that we could, right? You're talking about the supplement you submitted for this, right?
Yeah, I mean, the actual project, I don't remember getting any feedback.
Yeah, I don't know.
Yeah, like,
I can't comment on whether you or why you what the standard practice is, I guess, in terms of providing feedback on the projects itself from what you submitted. But what I will say is, if that's something that you want as a part of the the engaging the hub, I don't see why we couldn't. Or I don't want to overstep. I don't know if you have other opinions, Robin and Muggs.
Yeah, no, you're exactly right. And really, that's fundamentally why we're here, is to help guide you through what you proposed. And it's unlike a contract where you're contracted, you have to do it this way. I think this is the wonderful part of having the consultation and it being the supplement to us being able to work together through developing what you propose to do. So yes is the answer, the easy answer. And the exciting part is that we do get to work with you through the consultation hub to answer questions and do our consultations working with you.
Yeah, I agree. I might suggest if other supplement, PIs and teams are interested, could even think about doing almost a group kind of works in progress or research in progress. So I think there could be shared learning. Yeah. Rather than us engaging at the hub, if there were folks that wanted to, and we could find a mutually convenient time or set of times for a regular gathering to go over and give feedback on the different supplements. I think that would be tremendous, but I recognize it's another added thing beyond what everyone is doing. But if other sites, PIs are interested, maybe we could think about something like that, because I think the more folks around the table talking, for me at least, I always learn because everyone brings a different perspective and idea. So I would throw that out there as another possibility rather than just a one-on-one consultation, more of a group type process or setting, something.
Yeah, I see chat saying, well, it sounded like I was calling Lauren chat, but I see chatter in the chat, Lauren specifically, saying she would like that. And I think that's great. And, we have our quarterly meetings, and we could certainly make that more focused on that. And I kind of think that's sort of the intent of the quarterly meetings, but we can even expand it more and maybe do more often ones than even quarterly. But definitely adding on to that and having this focus, I think is going to be awesome. Thank you for bringing that up.
Yeah.
So I see, oh, go ahead.
You go ahead to say, Robin. I know folks may need to drop off, or I think we're at the 11 o'clock hour, at least our time. But Marjorie, I'm happy to stay on if you have a question and you want to go ahead and ask it. I have time to stick around for a little longer.
Okay, this would probably be something that's brought up again, because I have questions about, that process model, that overarching model that links the different parts together versus what this person, I'm sorry, I didn't catch the name of the question about the process map, which sounds kind of different to me in terms of, what are you going to do and how are you going to do it? That almost sounds like a logic model more than the process model. And so I'm just wondering, I have a few questions because eventually I think if I'm writing different grants, that process model can really come in handy because you're proposing different things. And actually one of the grants, it's like, oh, we don't see how AIM 3 connected. And during your talk, I imagined making a new flow chart, you know, to show how that connected. And I guess that would be a process model, right? I mean, in terms of if I described it properly. And so if you have any insight about that, or if you have papers, that's fine too. I understand we're short for time.
Yeah, no, in both. I can probably get you some papers that talk about these and how you can use these process models. But I think your understanding is right on, at least in terms of how I think about typically using process models to, in a sense, frame in different aims. You know, the idea is that I think these models, by their nature, they're intended to sort of describe different steps of activities or groups of activities that you would do in some ordered sequence, right? And oftentimes, although, you know, from a grantsmanship standpoint, there's always the question of how closely you want your aims linked. But at the same time, I do think, to your point, you oftentimes want there to be some connection between these aims. And I think a process model, whether it's just for your own planning purposes or for using it as an explicit part of the proposal itself, helps provide those kinds of linkages between aims.
And it doesn't have to be implementation science per se, right? Yeah.
No, I mean, I think like some of the, there are, I think, a lot of good process models, if you think about them, even from kind of more general evaluation work that you could think of that might be applied here. So I don't think it's necessarily has to be kind of an implementation science kind of process model. The idea is that you have some way to connect the aims, and in the EPIS framework I talked about here, I think is often used. You'll see people talk about using the EPIS frameworks as a way to kind of categorize the aims. So you might have, you know, it kind of follows the logic model I talked about. Oftentimes people will start out trying to understand what's the context and how does that context influence the implementation of either strategies or the intervention itself. And that's really kind of an exploration. It's a very exploratory type of aim. And that often leads to preparation, which is the P in the EPIS model, right? So you use that information to prepare something. You prepare the intervention, meaning you may make adaptations to the intervention, or you prepare in the sense that you identify strategies that you can use to deploy the intervention. And then you have the I of the EPIS framework, which is, you know, the implementation of it. So that's where you actually go through the steps of actually using and trying to get people to use the intervention. So, and oftentimes you'll see aims that reflect those different activities. So again, I think that's one way, or one reason why I think some of these process frameworks or process models are so valuable in thinking about just kind of categorizing and linking your aims if you're thinking about an overall project.
Well, thank you. A big benefit of your talk is, you know, I thought, oh, I've just gotten through learning Cifer, you know, and then we had gotten some email about EPIS, and I started, you know, reading about that. And I thought, well, don't you have to choose one or the other? And, you know, this idea that you can take it and reframe it, like you have control of it. I felt boxed, honestly, you know, in implementation science. I felt like you have to do it this way. This is the framework, and, you know, you fit your aims to that. And so, yeah, thank you for your talk. Yeah.
The one caveat I'll say is that you know, after saying it, you know, you're not sort of locked into one theory. You don't have to make this one theory or framework work for your entire proposal. And I think I still think that's true. I do think reviewers sometimes get a little twitchy when there's too many theories. You know, that there's so many that it's confusing. You know, how do these all fit together? Why do you need so many? And how do you make sense of all that? So there is a fine line, I think, where you can have too many. And I don't know what that number is, but I've oftentimes heard that from both kind of internal reviewers on panels as well as from NIH reviewers, that there is such a thing as too many theories and frameworks that work. So,
But I think maybe classifying them the way you have, which is like determinant frameworks or evaluation frameworks, or, if you say it that way, it'll help them rather than throwing out all these acronyms that drive me a little bit bonkers.
yeah, no, I think that's true. I think trying to, explain why you're using different theories, and that if you can explain to them in a way that makes it clear that they're playing complementary roles. Like, for example, these evaluation frameworks are really helpful for the outcomes and being able to understand what are the right outcomes and why you're using these particular outcomes. But that's not going to tell you anything really about what types of contextual factors you need to consider. So you can, as long as you can kind of make sure it's clear that these frameworks are playing complementary roles, reviewers, I think, get a little less twitchy.
Mhm. Thank you.
Sure. All right. Anything else, Robin, that we need to cover?
Well, I